To access ports, the nurse correctly identifies type of port and Huber needle for accessing, including identifying special power port needle if needed for port used by CT scans. Verify the length of time the port will be accessed and review allergies. Greet and identify the patient using 2 patient identifiers. Take vital signs. The minimum needed is at least a temperature to rule out infection. Perform hand hygiene. The nurse will explain the procedure to patient using age-appropriate language as needed. Gather supplies and equipment. The nurse then dons mask and gloves prior to establishing sterile field and appropriately position the patient. However, gloves are not mandatory. Add the appropriate supplies to the sterile field. Don sterile gloves. Cleanse the skin over port with chlorhexidine product. Cleanse an area of 10 to 12 centimeters in diameter over port site with chlorhexidine product. Work from center of periphery in a back and forth pattern for 30 to 60 seconds. Discard swab stick after single use. Prime injection cap and extension of the Huber needle. Make sure blue connection caps are securely attached. Accessing a conventional implanted port. Pick up the Huber needle with dominant hand, holding the extension with cap and syringe in palm to keep sterile. Stabilize the port by holding it between thumb and forefinger of non-dominant hand. Insert needle at 90-degree angle until it reaches the bottom or back of the metal portal chamber. Flush with 1 to 2 mils of saline. Aspirate for blood return to check correct catheter and needle placement. If needed, place a chlorhexidine disc over the needle and hold in place. Stabilize needle using Steri-strips and cover the insertion site with Tegaderm, Sorbaview, or appropriate 7-day transparent dressing. For ports that are difficult to obtain blood return, have the patient sit up or lie down or cough if able and aspirate for blood return. If still no blood return, consider deaccess and reaccess with a new needle. Keep in mind if you need a longer needle. If still no blood return, consider cath flow. If blood return is not possible, discuss with provider for dye study. Document on the dressing your initials and the date of access. Make sure to document on all appropriate patient care records, the LDA, progress notes, etc. For port needle deaccessing, explain the procedure to patient using age-appropriate language as needed. Perform hand hygiene and put on gloves.
Alright, cleanse injection cup with alcohol, swab for 15 seconds. Attach a 10 cc.
Cleanse injection cap with alcohol wipe for 15 seconds and attach a 10 milliliter pre-filled saline syringe. Flush with 1 to 2 milliliters of saline, then draw back to check for blood return.
Cleanse injection cup with alcohol wipe for 15 seconds.
Flush with remainder of the first saline syringe and flush with a second 10 milliliter saline syringe for a total of 20 milliliters saline flush.
With alcohol swab for 15 seconds.
Flush with 5 milliliters of heparin, 10 units per milliliter, in a blue syringe if reaccessing the port within 1 week. If longer, use the yellow syringe, which is 100 units per mil of heparin. Remove syringe from injection cap and then clamp the line. Remove dressing from needle and port using aseptic technique. Cleanse around Huber needle with chlorhexidine for 30 to 60 seconds and allow to dry. Hold the clear wings of Huber needle stable with fingers and withdraws needle until safety clicks, indicating it is activated. Discard in Sharps container. Apply pressure with gauze until bleeding at site subsides. Then apply a Band-Aid to site over the port.